We have a dynamic duo that's going to present for us. First, I will introduce Dr. Shinobu Watanabe Galloway. She is a professor of epidemiology, and she also serves as the co-director of the Biostats and Epidemiology Core of the Great Plains IDEA CTR. And I will definitely give you a little bit of a recap of that over the lunch hour too, so you're aware of the Great Plains IDEA CTR, or at least get a little bit more information about it. She's also the research director of the Behavioral Health Education Center of Nebraska and associate director of the Buffett Cancer Center Community Outreach and Engagement Office. Also with her today is Dr. Abraham Mengist. He is an assistant professor in the Department of Epidemiology within the College of Public Health at the University of Nebraska Medical Center. He is interested in researching the epidemiology of malaria and Helminth infection. Hopefully I said that right. HPV vaccine acceptability, and cervical cancer prevention. He is a team member of the Biostatistics, Epidemiology, and Research Design Core in the Great Plains IDEA CTR, along with Dr. Watanabe Galloway. Please welcome Drs. Watanabe Galloway and Mengist.
Good morning, everyone. We are very happy to be here this morning. See some familiar faces. Again, we are very happy to be here to give this presentation. So we wanted to make sure this session would be interactive. So Dr. Mengist will give a very brief presentation and followed by a group discussion. So hopefully that would kind of break the monotoneness of the session.
Thank you, everyone. Morning, everyone. So because the introduction has been already given, the presentation, this lecture will be a brief presentation on study designs with a focus on quasi-experimental study design. So the objective will be to describe the different types of study design, weaknesses and strengths with a focus on quasi-experimental study design. Depending on whether the researcher will assign the intervention or the exposure to the study participants, study designs we can use to test a given hypothesis about simple association or causality relationship between an exposure and an outcome variable can be experimental or observational study designs. In experimental study design, the researcher will assign the exposure to the study participants and see how that will affect the outcome that we are interested in. On the other hand, in observational study design, the researcher will not affect the exposure status. The researcher will simply observe what will happen on the study participants over time. So these observational study designs can be analytical or descriptive. As the name indicates, analytical observational study designs are designs mainly used for testing hypotheses, and the descriptive observational study designs are those used for describing the clinical characteristics. And of course, analytical observational study designs can be cross-sectional or case control, or they can also be prospective, depending on how the data is collected, of the timing for the data. What we call cross-sectional in case control study design, data is collected at one time point. In the case of case control study design, we collect retrospective data. And in the case of prospective cohort study design, the study participants will be followed for some time prospectively, forward in time. So data will be collected at least at 2 different time points. This will allow to make causality relationship between the exposure and the outcome in the case of prospective study design. In the other type of study design, we can use to test cause-effect relationship with the experimental study design. As I said it before, in experimental study design, unlike the observational one, the researcher will apply the exposure to the study participants or will introduce the intervention and see how that will affect the outcome. depending on how the researcher assigned the treatment to the study participants, this experimental study design can be randomized trial, or it can be non-randomized. What we call randomized trial is when individuals have equal chance of being assigned to the treatment and to the control group. So randomization is a technique for assigning the treatment to the study participants, but this may not always be possible. So in that case, we can also assign treatment on non-random basis, what we call quasi-experimental. So in classical experimental study design, the researcher usually selects the study participants and randomly assigned to the treatment and control group. Then the researcher will collect information on the dependent variable as well as the baseline characteristics of the study participants. Following that, the intervention will be introduced just one group, and then after some time, the outcome or the dependent variable will be measured on both the treatment and the control group. So at the end, we will compare the change in the dependent variable between the two groups. That's what the classical experimental study design looks like. And there are some important features or characteristics we need to know about experimental study design. One is, for example, prospective in nature. Experimental design is prospective in nature. We follow study participants forward in time from a given time point 0. It doesn't mean that all study participants should join the study at the same time, but everyone will have a time point 0 and then they will be followed forward in time. And another feature of the experimental study design is the researcher will actively manipulate the exposure status of the study participants. And another important feature is a control group. We always need to have a control group, which, and these control groups needs to have a very similar baseline characters with the treatment group. This will allow to make inference on cause-effect relationship. And of course, the main important feature of this experimental study design, particularly the true experimental study design, is randomization. What we call randomization is every individual assigned to the treatment or the control group will have equal chance of being assigned to this to the group. So grouping is based on random basis. And the last one is blinding. Study participants as well as data collectors usually be masked from knowing the treatment status of the individuals. This will allow unbiased collection of data to make a good inference about the causality effect relationship. But although randomization will allow to create comparable treatment and control group in experimental study design, particularly in true experimental study design, this may not be always true, or this may not be always possible because of practical or ethical reasons. For example, some study participants might be naturally embedded in a large group. Let's say students in class, patients, hospital patients in wards, and participants in an intervention programs, they usually are embedded in a large group. So random assignment of the subjects to the treatment and control group may not be possible. Let's say if you are interested in evaluating the effect of a given educational program in improving the behavior of students, if you select one school, and you may get some teachers who are interested in incorporating that educational program in their curriculum. But let's say a teacher is interested in incorporating that program in that class. Everyone in that class will receive that intervention. And but you cannot assign one student in one class for the educational treatment group, another one for the control group. So in this case, when subjects are naturally embedded in a large group, you will be forced to not to assign individuals to the treatment and control group based on non-random basis. And sometimes randomization may not be possible because of ethical reason. If someone is interested in evaluating the effect of a given potentially life-saving new drug or surgical procedure in improving the patient's life. The patients have the right to know which treatment groups they are assigned to, and they have the right to know what this new drug is and what is this new surgical procedure is. So randomization process may not always be possible in these situations. In this case, the type of study we will apply when randomization is not possible is what we call this quasi-experimental study design. It's a study that resembles experimental study design, very similar with experimental study design, but subjects are not allocated to the treatment and control group on random basis. And of course, control groups may not always be included. So this quasi-experimental study design is in between the observational study design and the true experimental study design. And briefly, what we call this quasi-experimental study design manipulate the independent variables. We call the measurement of the dependent variable, and there is no randomization process in assignment of subjects to the treatment and control group, and we may not always have a control group. But this quasi-experimental study design can be still used for establishing causality relationship in situations where randomization is not possible and when control groups are not included in that study. And this is more suitable for testing causality in natural setting, in real world setting. And there are several types of quasi-experimental study design. The most common ones are the comparison group pre-test post-test study design and the time series study design. What we call the comparison group pre-test post-test quasi-experimental design is very similar with the classical experimental study design, except that it lacks a randomization process. So in this type of quasi-experimental study design, we select the study participants, measure the dependent variable, introduce the intervention, and we'll measure again the dependent variable. So dependent variable will be measured both before the intervention and after the intervention, and then at the end we will compare the change whether the treatment to make inference whether the change is due to the treatment or not. And this time series study quasi-experimental design is mainly applied when we are interested in evaluating the impact of the treatment on the outcome for a longer period of time. So in this case, the researcher will administer the treatment and then withdraw the treatment and measure the outcome repeatedly for a long period of time. And the intervention can be introduced again, and the dependent variable could be measured. So we will measure the dependent variable repeatedly for a long period of time to see, how that change occurs. For example, if someone is interested in measuring learner performance in a given college on a weekly basis, and then introducing a new technique, then withdrawing that technique and again measuring on a weekly basis to see how that intervention affects the outcome over a long period of time. So this is what we call a time series for the experimental study design. So this table briefly summarizes main important differences between true experimental and the quasi-experimental study design on three major areas: on participant, study procedure, and emphasis. Of course, the main difference, as I said it before, is lack of randomization process in the case of quasi-experimental study design, which will lead to groups that are not comparable in nature, and subjects could be selected, may not be blinded for the treatment group in the case of quasi-experimental study design. And this leads to selection bias in the case of study participants, or also bias in the case of outcome assessment. And as far as the study procedure, we cannot fully control the study procedure in the case of quasi-experimental study design, and we may not fully manipulate actively the intervention program. And we may not have also usually a control group in the case of quasi-experimental study design. And the last point, through experimental study designs are usually conducted in real, very controlled environment. So the internal validity of the study will be very strong. That will increase the power of the study to make cause-effect relationship. But in the case of quasi-experimental study design, the studies are conducted in real life situation, in natural setting. So there could be some additional variables that may affect the outcome that we cannot fully control. So cause-effect relationship, the final conclusion could be affected, but the conclusion can be more generalizable because they are conducted in natural setting. So in quasi-experimental study design, the treatment and control groups may not be covalent. Why? Because there is no randomization process. And this will affect the internal validity. And with this will reduce the power of the study to establish cause-effect relationship. So overall, we need to carefully select our study design depending on our research question. The nature of the selecting a given study design to answer a given research question or to test a given hypothesis may, of course, depend on several factors. For example, when we start a given study, because we may not have enough sources or we may not have enough time, we may start by conducting observational study design to get some information about the relationship, and then we can continue quasi-experimental or true experimental study design from that. Because the true experimental study design is very time-taking, it's very expensive, so we may not take it as an initial step to start a given study design. Thank you. Any question?
If you could talk a little bit more about like a phased approach and how that lands in the different studies designs, meaning, yeah, phased approaches in terms of you work with this group and then you phase in the next group. So they all receive the intervention, but you're also studying them in such a way. It's valid.
So you mean this one? Or this one? Sorry. You mean this study design? Yeah, so it's just like the classical experimental study design. We select the study participants, and then we will collect information about our outcome of interest, that is the dependent variable. And then the treatment will be introduced just to one group. Then after some time, we will measure the same variable, our outcome of interest as a dependent variable on both the treatment and the control group. And then at the end, to make a conclusion on the relationship, we will compare the changes in the dependent variable in the group that receives the intervention and in the group that do not receive the intervention. That's a simple way of conducting this pre-test, post-test for the experimental study design. Does that make sense?
The question is about how to do the phased approach, right? If you can give us a little bit of context of the research question you may be thinking about using phased approach, that could help us better answer your question.
It's a great, actually, I was just speaking generally because I've seen it a lot in evaluation studies, but just wanted to hear what you had to say about phased. I don't have like an actual one off the top of my head, sorry. At least one that I'm able to talk about. I am currently doing a research study, but it's not in this way. So thank you, sorry.
So I think what we can do is to make sure to provide more information about phased approach by providing some resources to, give you more detailed explanation sometime this week. So that way you can be better informed about different approaches. Okay, all right, thank you. Emily, if you can remind us. to give you guys. Okay. Any other questions in general about the study designs and pros and cons? Okay, if not, so previously, did you all work in the small groups? Because we have, too many individuals to be presenting individual results. So if you can work within a table setting, that's great. And those of you who are online, you can work with other people or individually, but we are going to give you a chance to present. So okay. So before we break out into the small groups, I want to give you some example of how this breakout session would work. So each group should choose one set of research questions. It could be one of the team members' research question, or you guys can collectively come up with research question. But that's the starting point. You just have to pick some kind of research question for which you are going to quickly design a study and think about recruitment and data collection. So this is a mini exercise for you to think through study design and recruitment and data collection. And there is really no wrong answer here, just to get you guys think through the process. So let's see, this would be our example research question. Will farmers who receive a new social marketing message tailored toward farmers population be more likely to receive colorectal cancer screening than farmers who do not? So this is actual study from my project. We are working with Department of Health and Human Services, and they didn't do the randomization, but they have the list of rural community members in Nebraska, and they divide the group into two groups, right? And one group of rural residents would receive tailored message versus other residents just get instruction to do colorectal cancer stool test, FIT test, so they can do their own self-screening. So we hypothesize if we use the tailored message, that would motivate them to return the FIT kit. So that's like a motivation here. So that's my research question, okay? And then, so obviously target population is farmers in, Nebraska and other Midwest region, because if you talk about Louisiana and some other region, their behavior and cultural beliefs might be different. So I said, my population is a Midwestern farmers. So that's very important for you to think about what is the underlying population you are interested in, because not your results would not be applicable to all different populations. Okay. Okay. And then you just need to pick some kind of, study design. Are you going to do cross-sectional study? That's fine. You are just going to collect the data at one time point, right? Are you going to do a case control study, prospective? If you are familiar with all the different research study design, you can pick whatever you want, okay? If you are not sure how to pick the study design, we can walk around and help you to think through, okay? And then you need to determine what is your outcome of your interest. In this case, since it is an intervention study, we said this is a return of FIT kit. It's a colorectal cancer screening test to compare the return percentage between two groups. So that's the outcome, okay? And then what is your intervention? It could be exposure, but if you are doing the intervention, what is your intervention? My intervention is social marketing campaign, right? Tailored approach. So that is the intervention. Okay. And are there any other variables you are interested in collecting? So since research question is about intervention's effect on the outcome, the simplest way to think about the relationship is this 101. Intervention causes the better fit return, right? But then there are many other factors that could explain why some people are more likely to return the fit kit versus other people don't. Maybe it has to do with the age. Maybe females are more likely to be compliant. It could be educational level, or it could be the awareness of the colorectal cancer because you had a family member who had cancer or colorectal cancer. And those things, if you usually do a literature review, you can identify those factors that can explain the outcomes. So those are the factors you probably need to think about collecting, right? Because you need to also think about the roles of those variables on the outcome. Because if we look at the causal relationship between the intervention and outcome without considering the other factors, we may be making a wrong conclusion. So the outcome may be due to other factors, right? Okay. And then how will you collect data? We are going to use Farm ID company, which has the database of all the farmers, and they have the age information, sex information. So those information would come from them. But then mostly information would come from the survey. So you just have to think about, is there any existing data I can access to? Then go ahead and use it. Versus you need to do primary data collection by asking the individuals to provide information. How are you going to do that? Are you going to interview? Are you going to do a survey? And so on and so forth, right? And then outcomes, in this case, would be simply we are collecting to see which individuals would return the fit kit. So it's not the survey, just returning of the, test itself would be the outcome. Okay, so let's get you guys start working on it. We have about 15 minutes to work on it. Do as much as you can. If you guys need any help or questions, we are gonna walk around in the room to give you some help. Thank you. Okay, you might not have been able to finish all of it, but I think we need to start wrapping up because we need to let you guys eat lunch at 12. So I'm going to ask each group to choose one person to kind of go over what you guys have discussed. Each group should have a couple minutes to describe. So let's hear from everyone, starting from the back group right there. Yeah. And make sure to use microphone.
Okay. Hi. We didn't finish everything, but our research question that we kind of had was, does poverty contribute to poor sleep? And then for our target population were documented immigrant workers in Nebraska. And as far as our study design goes, that's where it got a little wonky. I think we ended up on cohort study or cross-sectional. I meant cross-sectional. And the outcomes or dependent variables, kind of winging it. We're still working on that part.
Okay.
But as far as the exposure and predictive variables go, we were using like social economic status since it was poverty related. And as far as confounding goes, we kind of spoke about how a lot of times when folks might not have as much money and have high hours, they might use various stimulants and how that could impact, the sleep that we see in the results from that. And as far as identifying eligible participants, probably going through community, specifically workers, because that's the primary goal. And we didn't get to how we would collect data. So
Okay.
that's it.
Yeah. That's good. Okay. Thank you. And if we have time, we can ask each other a question, but let's go to the next group right there. To the back, two of you sitting together. Yep.
Hi, we were chatting about it. I actually didn't write anything down, so we're actually gonna go for memory here. So my research question is testing the feasibility of a behavioral intervention and the population of interest is individuals with mild cognitive impairment and their care partners. The study design is a randomized control study, so we have a control group as well as an intervention group. And we're testing the outcomes of, for feasibility, we're looking at retention and attendance of this 12-week intervention. We're doing semi-structured interviews following the intervention, as well as the acceptability. And then as the secondary outcome, we are looking at step count because that's what we're trying to improve is for the physical activity, so daily stepping. Let's see, what else do we have here? So we will be collecting a lot of some of the variables that we anticipate may be confounding. So looking at all the common things like age, sex, gender identification, all of those things, as well as socioeconomic status. And we'll be identifying our eligible participants through some neuropsych clinics in town where they would be diagnosing individuals with mild cognitive impairment.
Very good. Okay. All right, then the next group in the middle, please.
So our question is, would adults who have access to specialized transportation have better access to care? Our group would be older adults recently discharged within the last 30 days. We would do a qualitative design through interview or focus groups. I think that's as far as we got. Okay.
All right, did you guys talk about what kind of questions you guys might be asking during the interview?
No, we didn't get that far.
Okay, that's fine. Okay, next group right there.
All right, our research question is gonna be, will providers or helpers working with Indigenous communities who participate in traditional Native American healing ceremonies be more likely to report less compassion fatigue symptoms over time? Our target population was helping professionals working with Indigenous fatigue, that are witnessing firsthand trauma, secondhand, or learning of it secondhand. Study, is that us? Whatever.
I have no idea.
Okay, our study design is mixed methods. The quantitative part would be pre-test, post-test intervention design. We'd have baseline data on compassion fatigue. With 6 months intervention, we would use something called full moon ceremony for the intervention. We would measure again afterwards. We would be working in one tribal community with workers that are witnessing trauma. The qualitative part, we do focus group, we record and transcribe and come up with themes. And we hadn't talked about which questions yet, but our outcomes would be compassion fatigue and measuring that, and that's all we got.
Very nice. Thank you. Okay, the group in front.
Yeah, so we talked, our research question was, how does participation in Girls Inc. affect diet and stress? And so the target population would be girls in Girls Inc. and girls who have never been to Girls Inc. And we do an observational cross-sectional study comparing those two groups. The outcomes would be vitamin levels in the blood and cortisol levels to look at the diet part and then the stress part. Exposure or independent variable would be participation in Girls Inc. We would assess for confounding, like how long the girls went to Girls Inc., their age and exercise and socioeconomic status, and then we would identify eligible participants through a partnership with Girls Inc. and social media ads as well. And then data collection would be in person, primary collection of all the.
Thank you.